Hello, good evening. I am so excited to be back with my good friend, Steve Dale, and a magnificent guest tonight to talk about something that we don't talk nearly enough about. And she has pioneered. You're really a hero, pioneering a field that was not getting a lot of attention and is changing lives. So, Steve, I'm going to turn it over to you.
Yes, so because I get to introduce a friend. And Robin Downing at this point is a friend and a trusted friend who I adore, respect, and I cannot tell you how much. You know, when I get to share a stage with people like Robin Downing at veterinary conferences, and here's what happened. I had this idea. I know that Dr. Downing is not a fan of declaw. That is an understatement. And I thought, and I'm not either. So I thought, okay, both of us can present together. I could talk about behavior. But I thought, you know what? We can look at cats that seem to have a normal gait. They seem to, but Dr. Downing, who is one of the world's experts on pain in companion animals, can look at that cat and say, that cat's been declawed, I can tell. And there aren't many eyeballs, that even veterinary professionals, that can do that. She is an expert on pain management, rehabilitation medicine, veterinary ethics, which we'll talk about as well. I want to talk specifically also about declaw, an expert when it comes to the human-animal bond, and like me, has at one point served on the board of the Human-Animal Bond Association, and just received one of the most, if not the most prestigious honor in veterinary medicine, the Leo Bustad Award. And we'll talk about that too. I mean, that is huge. Friends, if you have questions, this is the person to ask if we're talking about any of those things. Dr. Downing has more letters after her name than I will ever have in my name. She is absolutely brilliant. I said in the blog post you are also a CPA, which is, did you know that? Those are letters that are now after your name: certified public accountant and certified plumber's assistant. If there are letters to have after a name, she's got it. And I think we can start from there. And I can ask the first question. And I think I will just dive right into it. Cats in particular mask pain. Do you have any hints as to how you can tell, aside from the obvious, or maybe not so obvious? They're not going up and down stairs as much. They're not jumping up on the high places. And that may not be so obvious, but even more deep than that, where those only watching right now will get this information.
Well, first of all, great to see you, Stephen. You are, in fact, one of my favorite friends, so thank you very much for that introduction. And Doc Liz, it's really my pleasure to be hosted by you this evening, and it's so nice to meet you. And this whole issue with cats and pain and who are they and how does this work? It's really, really intriguing to me. And I was educated in the veterinary profession 100 years ago, it feels like, when we still use stone knives and bone rattles to figure out how to treat our patients. Pain and pain management was like barely a thing when I was in veterinary school, and no one talked about pain in cats. We know that cats are predators by nature, and because they're predators, we know that when a predator can't predate, they become someone else's lunch. And so it's not in a cat's best interest to tell us that something is wrong. So detecting pain in a cat, when I speak with my clients and my colleagues, I focus on behavior. And as we all know, the number one cause of death in cats is euthanasia, even beats cancer and kidney disease. And the number one reason for euthanasia is behavior that we as humans perceive as inappropriate behavior, whether it's litter box behavior or scratching behavior or biting behavior. And what we fail to understand as humans, because humans are a little dull on the smarts scale, we're not as smart as cats, is that when a cat behaves in a way that we perceive as inappropriate, or an inappropriate interaction with the environment or with a human or even with another cat, that we have to consider pain as a potential reason. So you named some things, Steve, that are important. Reluctance to go up or down stairs, reluctance to go vertical. That's a very normal cat behavior. If they won't go vertical, it means usually something's wrong. But here are some cues that I hear in the exam room. Well, she doesn't like me to pet her there, wherever there is on her body. Or she hides more than she used to. Or he sleeps in the closet now and not in my bed. Or he really doesn't like kids. Or anyone comes into the house, a stranger, and he disappears. He just doesn't like to be touched by people he doesn't know. Or one of my favorites, a change in eating behavior. Now that's a pretty subtle thing, a change in eating behavior. But it's very common for cats to have their food and water dishes on the floor. And if they have back pain, reaching down to the floor to eat puts stress and strain on their back. And even though they know they need to eat to survive, it may be that they're really balancing the benefit to burden of bending over and touching their toes, which is really our human equivalent of them reaching down to eat.
Wow.
And we hear so much in pop culture is my cat is vengeful, or she's mad at me because, insert thing. I really am passionate about changing that way of thinking and interpreting their behavior. Because for us, we start looking at it that way, and then we change how we treat them. Nobody likes someone that's mad at us, right? But if we could open our minds to, she hurts, then we would really interpret behavior differently. And I'm so optimistic that it would change how we interact with them to a much more empathetic place. So I'm so glad you talked about how hunters don't show pain, distress, fear in a way that humans do. And so we really have to almost know ahead of time what pain signs are in cats, or go to the vet.
Well, and that's really where coming to us as veterinarians is really a very important step. And I love the fact, Dr. Liz, that you specifically talk about our obligation to really rethink some of the common fallacies that are out there, like my cat's mad at me and that's why she peed on my bed. It's like, no, she peed on your bed because she feels like crap and she really wants to get your attention, and she knows that will get your attention. And one of the reasons I'm so passionate about this is that, as you know, I'm now formally trained as a clinical bioethicist. And a bioethics is all about ethical decision-making at the bedside, or in our case, ethical decision-making at the cage side, at the table side, at the side. In cat case, might be at the litter pan side. The point being that the minute we acknowledge that cats have moral agency, it really now becomes our moral obligation to look at their life through their eyes and understand that they can and they do express preferences. We know, and it is commonly acknowledged, that while animals cannot and do not anticipate or fear their own death, they certainly can and do anticipate and fear pain. And the real problem with that is they don't have a futuristic perspective. So unlike me, when I go to the dentist with the tooth that needs an emergency root canal, I can actually think about the fact that I will feel better tomorrow. And the cat can't do that. They live in the immediate moment. They're so zen in that respect. They are always present in the moment. And for them, that torture that they feel when they're painful is, as far as they're concerned, that's their reality forever. And as soon as we understand that piece, it opens the door for us as cat owners. So I'm a crazy cat lady. I typically don't acknowledge this except in the privacy of the conference ballroom. But I'm willing to go out there and tell everyone who's listening that at one point between my house and my hospital, I had 17 cats. And they all had a medical issue, because if you're going to live with a veterinarian, you have to have a medical issue. Because otherwise, to talk about a group therapy every week. So we had paralyzed cats and one-eyed cats and three-legged cats. And my point being that I love cats, so I don't just see them as veterinarian, I see them as a cat owner. And it astounds me how rich they are in their emotional life if we're only willing to recognize that. And a state of pain for them absolutely undermines and curtails that otherwise very rich life that they lead. So now we as cat owners and we as veterinary professionals, we have an obligation to really reframe what we see and really try to see the world and life through the eyes of that cat. And what is that cat experiencing?
And, I think it's really new that moral agency was the word I think you used.
Yes.
In the 70s and 80s, when I was a kid, we didn't really think animals had an internal world. Mm-hmm. What could you say to someone who is, mind blown right now, thinking about this for the first time? This is kind of new, and it seems for people who are hearing it the first time, like, these people are nuts. It's just a cat, or it's just a dog. And you're, whatever the closed-minded thing that they might think. And I don't mean that in a mean way. I mean it that a lot of people aren't exposed to this information. And when you're hearing it for the first time, it's hard to wrap your brain around. How do you start to get people to understand?
So specifically for cats, where I would direct people, first of all, there are two really rich sources of resources of information that are fast, dirty, easy to access. The first, specific to cats, is very simply to ask your internet browser to find you the space called Cat Friendly Practice. So the American Association of Feline Practitioners has developed this program called the Cat Friendly Practice. I'm very, very proud of the fact that my practice was the first gold level cat friendly practice in the state of Colorado. And I'm also very proud of the fact that even though I'm a mixed animal professional, because I still see dogs, I love dogs, I just can't say no to them. I actually see more cats than most of the cat only practices in my area, because we are a cat friendly practice. The other resource I would send your listeners to, and the people who are on this site tonight, is a very fun site called Fear Free Happy Homes. Fear Free Happy Homes provides huge volumes of resources, not just for cat owners and cat lovers, but for dog owners and dog lovers. It's complimentary membership and constantly being updated with new resources to better help cat and dog owners better understand, what am I seeing when I see my cat behave this way? What am I seeing? If I am witnessing a behavior that hasn't been present before, or it's something that I would like to modify, how can I do that? How can I do that in a way that's ethical, meaningful to the cat? How do I speak the cat's language? And those two resources, realistically, Dr. Liz, those are two places that people can go right away to get good information that's accurate, up to date, and ethically viable.
And we've invited Tika here tonight, and I will definitely send this link back to the Tika administration and make sure that they get this out to their membership, because I think this is so important. They also, they're mostly purebred breeders, right, and then enthusiasts, and they're really amazing touch point as an authority figure to people who are bringing cats into their lives. And the more that we can make people understand and communicate this, I call it with disciples. So the next person, next person, it's time to change. Yeah. We really need to understand this.
Well, as a contributor to both those websites, I'm yes, you chose good ones. But truly, Fear-Free Happy Homes, as well as the cat-friendly practice. You go on the internet and it's tough because there's so many choices, and the stories, I'm supposed to know what I'm talking about, but those stories are reviewed that I write not only by an editor who's a good editor, but it goes way further. It's like a peer-reviewed journal. A veterinary behaviorist or a technician certified in behavior reads those stories. Speaking of which, I have some questions here about declaw, and incidentally, the executive director, Dr. Downing, of the Win Feline Foundation is here watching. Yes. Oh my God. Win Feline Foundation supports funding for cat health studies. And as you know, pretty much everything we know about cats has been funded by the Win Feline Foundation at one point or another. And
I'll put a link below when we're finished to donate, because they rely a lot on donations to make this incredible work happen. So even if you have a few bucks hanging around that you didn't spend at Starbucks because you're staying at home, send it to the Win Feline Foundation.
Okay, so
Steve, can I interject something?
Sure.
I have ADD and I don't take drugs, so I get distracted by the bright shining object. And I'm seeing in the chat box that someone said something essentially that cats don't have emotions like we do. Honestly, I need to refute that. Cats don't have maybe the same emotions that we do, but they have a very rich emotional life. And that is really coming to light with some of the research that's being done on some of the brain studies. Now, no one's been able to talk a cat into being as patient as border collies can be when they're being trained by Dr. Brian Hare at Duke University. But some of you may be aware that there's actually, his is not the only laboratory that's actually looking at using functional MRI technology to have an animal, in this case a dog, in a functional MR, stimulating that dog with olfactory input, ocular input, so visual input, auditory input, and then watching what parts of the brain actually light up in response to very specific stimuli. And what this really did, and this was just some of the most intriguing research I think I've ever read as an adult human, it really unlocked this whole Pandora's box of understanding that the animals we share our lives with have very rich emotional lives. One of the ways that we can understand this with cats is understanding that there are cats who grieve for cats in the household who die. There are cats who grieve. We witness grieving behaviors when a human in the household dies. And this is really, it's so funny to have come out of veterinary school in 1986 when It's Just a Dog or It's Just a Cat was just beginning to be undermined as a common cultural moray. But I was never taught as a veterinarian that animals had an emotional life. I was taught that they reacted to stimuli, but it was really just a reaction of a very much a primitive brain back here, reptile brain kind of reaction, like a fight or flight reaction. But they didn't really think about what they were doing. They didn't really think about their environment. But we know so much more now. I think about some of the behaviorists that I know and respect, both veterinary technician specialists in behavior and boarded behaviorists, who talk about teaching cats, like teaching cats. Who thinks like that? Well, when I came out of veterinary school, I was taught you can't teach a cat a darn thing. Well, now we know we can. The only way that we can really get to that place is to really acknowledge, understand, and appreciate just how rich a mental life they have, but also how rich an emotional life they have.
I'm sorry, I do want to dive into declaw. There's a comment here of why is this even a discussion? It's been illegal in the UK and it now is illegal in the US in certain places. But I'm going to say something bold. Even the AVMA is not ready to bring down any kind of statement about how veterinarians should behave. And nobody, particularly doctors, don't like to be told what to do. But I happen to feel pretty strongly that we should not have declaw, that it should be illegal. And I'm willing to say that, and I understand that's controversial, and that's okay. I am very happy with not everyone agreeing with me.
Well, it's not controversial among the two people you're talking to, for sure. Yeah. And Dr. Downing, in fact, she testified in Colorado and helped to make it illegal. That's part of, and her testimony, by the way, was epic because I've seen it. But
can you tell us about that?
I want to talk a little more about what the consequences are. So if you go back 10 years, approximately, there was data to indicate it really didn't matter. It didn't matter behaviorally, and there was not talk about pain because, as Dr. Downing just talked about, no one really talked about pain anyway. Now it's another story. And when you look at the more recent data, you see something entirely different, which Dr. Downing will talk about. And I also want her to articulate her observations of what she has seen and what studies have shown cats really do feel X number of years later.
So what a great springboard, Steve. So thank you so much. So first of all, as controversial as you believe your statement might have been, Dr. Liz, I feel like I'm in a poker game. I'll steer 10 and raise you 20. We need to stop calling it declaw. The term declaw is a sanitized term for what is a barbaric procedure, which is feline toe amputation. And I think that we, in the veterinary profession, we have an obligation to call it what it is. So you will hear me use the term feline toe amputation basically from this point forward. I actually never employ the term declaw anymore. And there are really three big areas that drive us to reconsider the appropriateness of feline toe amputation. The first, Steve, you raised the issue of pain, and I want to talk about pain first. So let's talk about pain first. So first and foremost, cats are wired just like we are. They're hardwired just like we are. And one of my very favorite pain specialists, he's internationally renowned, said this about pain. If they have the hardware, meaning the nerves, they can run the software, which is the pain experience. Cats have all the same wiring that we have. And what we fail to remember is that when we amputate their toes, we are performing a trauma on multiple tissues that have incredibly dense sensory input into the nervous system. So here we have cut nerves, and what cut nerves often result in is what's called phantom pain or neuropathic pain. Now, I went through a period as a pain expert in translating human pain issues to animal pain issues of hesitating to use the term neuropathic pain. And the reason is that in human medicine, in human pain medicine, the term neuropathic pain involves how the patient describes their pain experience. And we know that cats and dogs can't self-report the way that a human can. So technically, we should call neuropathic pain altered sensation. Honestly, I think it's a moot point. Let's call it neuropathic pain because people understand what that means. Somebody in their family, somebody they know, or perhaps they themselves have experienced neuropathic pain. They've had shingles. Shingles is a form of neuropathic pain. So when we cut a nerve, we actually set the nerve up to create an ongoing self-perpetuating pain experience that is extremely difficult to control and almost impossible to reverse because it involves changes in the nervous system that become permanent anatomic changes. Now, we really didn't understand those changes until we had the current technology we have to visualize the nervous system. But there are changes that happen in the dorsal horn of the spinal cord that make this pain perpetual for the rest of the animal's life, for the rest of the cat's life. In addition, we also have the pain associated with the joint capsule. The joint capsule is extremely rich with nerve endings. And when we have an acute pain experience in a nerve-rich environment, even if we provide some analgesia around that surgical event, that acute pain can be transformed into a chronic pain experience. That's called maladaptive pain. And that's different from neuropathic pain. Maladaptive pain is pain that is disproportionate to whatever organic stuff is happening in the tissues. The problem that we have that sort of feeds on that is that in every single study that has ever been done since the year 2000, we understand that cats do not receive appropriate analgesia around their acute pain experiences. So even people who are really well-intentioned miss some of these cats. So now we end up with cats who have chronic pain in their feet and chronic pain in their toes. And sometimes this will manifest in very strange ways. So I will sometimes have cats who've had their toes amputated, who the owner will report to me, you know, he's willing to walk on the carpet, but not on the tile. I touch his feet and he doesn't react, but he'll only walk on carpet, he won't walk on tile. We've had cats that decide that they don't want to use the litter pan anymore. Well, why not? Well, because the litter feels uncomfortable on their feet. So that's the more immediate, focused on the feline toe amputation part of it. But now we have to go to the next step, which is we change the biomechanics of the feet and the front legs when we amputate the toes. When we change the biomechanics of the feet in the front feet, here we have front legs that carry 60% of the cat's body weight on the front feet. Now we've altered the biomechanics of the feet. That alters the biomechanics of the entire body. And that means that we set the rest of the skeleton up for forces to be generated through the joints. There are abnormal forces to be generated through the joints. I'm board certified by the American College of Veterinary Sports Medicine and Rehab. Biomechanics was a big part of what I had to train in order to pass my board. Well, I was already interested and fascinated by biomechanics because I trained as a certified veterinary, a certified canine rehabilitation practitioner at the University of Tennessee almost 15 years ago. And it was in that training that I really got hooked on this idea of seeing how animals move and asking the question, if we alter how they move, can that set them up for pathologies later on? And the answer is absolutely it can. That's like fundamental research in human biomechanics. This is one of those situations where parts are parts. The parts may move a little differently in a quadruped than a biped, but parts is parts. Cartilage is cartilage. Ligaments and tendons are ligaments and tendons. Then we have the additional issue of our cats living longer than ever before. And Steve knows this very well. I have a cat in my possession who was rehomed with me when she was 18 years old. Wow. She had her toe amputation at 4 months of age. And Muffin is now 24 years old.
Wow.
I know. When I adopted her at 18 years of age, my wife and I looked at one another and said, sure, let's adopt her. She's 18. How much longer can she live? So you have to be careful what you say because you just might get an unexpected answer. She's 24, but she walks on her carpi. She has had a complete collapse of her feet and her carpus because she had her toes amputated when she was 4 months old. So these are the things that we can see now in our aging cats who had the misfortune of having a toe amputation when they were very young. The final perspective after pain and biomechanics is the bioethical implications of a feline toe amputation. When we acknowledge that cats do have moral agency, then we're really obligated to look at the fundamental and foundational principles of clinical bioethics: respect for autonomy, non-maleficence, beneficence, and fairness, justice. If we look at the respect for autonomy, this is very simply recognizing that animals can and do express preferences. And I think it's pretty self-evident that if we had the opportunity to have a cat articulate to us their preference to keep their toes or not, that their preference would be to keep their toes. And why would that be? We don't even have to go into the emotion of it. There are behaviors that are natural cat behaviors that are immediately interrupted if they lose their toes, if they have their toes amputated. They can't scratch like they are driven to do. They can't even really groom themselves as completely as they normally would, because if you watch a cat groom, they use their front feet to groom themselves. They can't climb the way that they are driven to climb, because they can't actually support the upper part of their body when they try to go vertical on a surface. I'm not talking about jumping, I'm talking about actually climbing. And then finally, when they are vertical and they decide to jump off of something, they really cannot land in a healthy and elastic fashion if they've had their toes amputated. So we have that part of the autonomy piece. Non-maleficence means avoiding harm. So we have to ask the question, when we amputate their toes, do we harm them in some way? And I think I've made the case that we harm them in many ways. We harm them by the immediate pain. We harm them by the potential for chronic pain. We harm them from the perspective of neuropathic pain. And we harm them by changing their biomechanics for the rest of their lives. Beneficence is this principle of acting in the patient's best interest. And again, asking the question, is it in any cat's best interest to have their toes amputated?
Now, here's where I think that we get the pushback. Okay. Because I practiced in a small family practice for a long time. And we would get people who would come in and say, if you don't declaw, I need you to put this cat to sleep because I just can't deal with it anymore. Which obviously my life has gone in a very passionate direction about managing behavior and making sure people understand that. But not everyone is there yet. So one of the pushbacks that veterinarians are very concerned about is, if we refuse to declaw, will people just euthanize their cats? And in that case, is it a lesser harm? How do you respond to that?
So that's a really, that's a very important question that you pose, and a very important point. And part of our response as a profession, it really, when I'm teaching neophytes issues around bioethical concepts and constructs, I really focus on the fact that part of our obligation when we know something our client doesn't know is education, education, education. So part of it is being armed with information. For instance, understanding that in California, in the Steve, help me, it was Los Angeles, was it not?
Yes, yeah. So go ahead, I'll let you do it.
Okay, so in LA, one of the concerns was, and part of the argument against banning the practice of feline toe amputation was, we are immediately going to see an influx of cats, unwanted, into our shelters because people are going to be unwilling to live with a cat with their toes. And what they actually found was that their census dropped. And part of the profile or the demographic of that census were those cats that were misbehaving. And what's been found is that cats that have had a toe amputation who end up in a shelter, there are actually more cats with toe amputation who end up in shelter than cats who still have their toes. So part of this really falls on our shoulders as veterinary professionals to educate, And we have tools now that when I came out of school in 1986, we just didn't have. Nobody was talking about feline pheromones at that point. No one was talking about environmental enrichment for cats at that point. And so I didn't have those tools. And with that, I'm going to ask you, Steve, to fill in what you know.
Steve, I don't think I've ever heard you not speak for this long. That was incredible.
She's amazing. I know. Well, I mean, you really pretty much covered it, but that's just the point. Today, we have tools that can prevent, so it's really a matter of educating or communicating, might be even a better way to put it, with pet parents to say, okay, this is what you're doing. You love your cat. So this is what you're doing. You may not be completely aware, but we can prevent this from happening, or we can fix this in all the wrong places. And we know today how to do it. And we've always known about behavior modification, desensitization, and that can work, but it's complicated for people at times. So today we have shortcuts like a product called FeliScratch, which is a feline pheromone that you actually put on an appropriate scratching post. And it is like a sign directing the cats to the scratching post. That combined with appropriate placement of that post, the number of posts per the number of cats, and making the place uncomfortable to scratch. If it's a sofa, for example, where they are scratching. So all of that we today know works. And what Robin Downing typically says, because I know what she says very well, the next sentence is, we love our animals. How many cats would vote for that amputation? And there's an ethical issue, not only the veterinary ethical issue you described, but the one other is this fair? It's an amputation. That's what it is. And it's an elective amputation.
So one of the points that I want to make sure I make is, because one of the common things as well, one of the pushbacks is, well, if I don't do it, they'll just find somebody who will. Well, okay. But here's something that's really important for us as veterinary professionals to understand. I'm just going to lay it out there. The majority of people do not know that what they call a declaw, and it's really a toe amputation. They really don't. And that's one of the reasons why it's so important for our profession to embrace this, like, it's not that new, but to embrace this vocabulary. So we call it what it is. Feline toe amputation is feline toe amputation. And once a cat owner knows what that is, first of all, the most common reaction I get when someone asks me, I'm thinking about having my cat declawed. Most of the time, they may be people who, when they were kids, they had cats that had their toes amputated and they never thought anything about it. I have to think back to, when I first became a veterinarian, and I was taught in veterinary school that this was a commodity procedure. And so it's a wham, bam, thank you, ma'am. Cut off the testicles, cut off the toes, and send them on their way. Cut out their ovary and uterus, cut off their toes, and send them on their way. I participated in that. And I am mortified to look back to my early career and realize what a barbarian I was. Our clients don't know what this is. And the minute we speak about it in this very direct and very fact-based language, that we're talking about amputating their toes, changing their feet, potentially causing them chronic pain, that changes the whole dynamic of the conversation. I gave up this barbaric procedure actually at this point in the pretty early aughts, and I've never looked back. And our clients that we embrace, who bring us their kitties, we're able to speak with them confidently and directly and let them know that we have tools to help them help their cats be good cats, good as we define good, which means finding them a way to express their natural behaviors. That's part of the fairness piece. If they're going to live with us, we have an obligation to make sure that they have a rich lifestyle. But it even goes beyond that. And that is really helping our clients, once they are shocked into understanding what this is, to also help them not feel guilty about cats they knew when they were younger, or cats they owned when they were younger and had this procedure done, to help them understand that that doesn't make them bad people. What I teach when I teach is you can't know what you don't know. But once you know something, you can't not know it anymore. And so when we enlighten them, this is just an amazing way for cat owners to be completely transformed in their understanding. They have a paradigm shift in their understanding of what is it that their cats really need.
And I think so many don't know. And behavior change and getting all that information out with consistency with everyone behind it is going to take time, unfortunately. One of my stories that I just will never forget is someone, elderly couple got married. It was adorable. And she had a 12-year-old, very round cat. And he said the cat had to be declawed. And they came into me to do it. And I had a very long conversation explaining everything to them. And he looked at me and he said, "Oh, honey, that's not right. You're doing it wrong." When I explained the toe amputation, you don't have to take that whole bone. You're doing it wrong. And I think it does take a lot of education. And I've never forgotten that. It was a transformative moment for me. So I'm going to put down in the links below also a diagram that people can they can show other people who think that this is okay. So we really know what we're talking about, that it's the bone that comes out, and often not even the whole bone, which causes other problems. So it's really time to take a stand.
And concerning one quick thing, Robin. So concerning the arguments against it, which, I mean, there was a New York Times story that Dr. Downing knows I talk about, saying that you can't declaw cats if you have autistic children, right? You know, I mean, stuff like that is just either kind of made up, or older people, like, and this is what made me think of it, those clients you're talking about, because they have thin skin, and they do, shouldn't live with declawed cats or they will die. And to my knowledge, I mean, for example, Australia, England, New Zealand, I can go on with many nations that ban declaw, and I do believe they have old people in those countries. So some of this is easily refuted when you actually have a conversation with people about it. And in my experience, you tell me what you think, Dr. Downing. In my experience, people then do begin to get it. There are exceptions, but most people do.
Well, you know, it's interesting, Steve, you actually went down the path I was about to go down, which is one of the common things that was that's been sort of put out there in years past is, if you are and forgive me for correcting what you said, because what you said was kids with autism shouldn't live with declawed cats. I think what you meant was they shouldn't live with cats that aren't declawed, and that's okay.
Thank you. Yeah, yeah.
The same with the whole old people, thin skin. It's very, very important for us as veterinary professionals to be crystal clear that the Centers for Disease Control and Prevention, which is currently under unbelievable attack in a completely inappropriate fashion, the Centers for Disease Control and Prevention has taken a very, very, very specific and very well articulated position that it is inappropriate for cats to have their toes amputated on the fantasy that people who are immune compromised shouldn't live with cats who have their toes. Old people with thin skin and on blood thinners shouldn't live with cats who still have their toes. they've addressed this. They've proactively addressed this and said, we've been used as an excuse for amputating the toes of cats. And we're here to tell you that there's no basis in fact for having that done. So thank you, Steve. You actually opened the door for exactly what I was going to say.
and the CDC, in fact, continues. They go on to say those cats are more likely to, in fact, bite. And that is more of a concern for us in the first place.
Exactly.
So I want to change gears just a little bit and talk about the award that you just earned, rightly so. It's named after a man by the name of Leo Bustad. I don't believe you're old enough to have met him. I certainly have never met him, but I'm aware of the legend that this gentleman was, who really is one of the first people out there. But another was R.K. Anderson, who I became very good friends with, actually, as you may know. And they're the guys who said, this thing called the human-animal bond is real. Here's what it's about. You've commented to me personally that this is, and you've won more awards than I would have time to rattle off here, that this is the big one for you. Tell me why.
So a couple of things. First of all, I did not have the pleasure of knowing, meeting, or working with Leo K. Bustad, but he, the doc, the man, the legend, he really is acknowledged as one of the most important people in opening this whole arena of our better understanding the human-animal bond. Of course, he was one of the founders of the Delta Society, which became Pet Partners, and that's that whole focus on having animals really interact with us in a way that heals us. You mentioned R.K. Anderson, and I'm so proud and pleased about the fact that R.K. Anderson actually was one of my most important mentors and just the dearest friend. And I am so pleased that I had the opportunity to share his 90th birthday with him, which was not long before he passed away. So these two individuals, just icons in the veterinary field, who have served to influence so much of what I've done as a veterinarian and in my career as an animal advocate. So this award that was named for Leo K. Bustad, this is in veterinary medicine, like winning the Oscar, really, for Best Picture. I mean, this is easily the most exciting and most humbling and most amazing experience. Really, it's just such a really amazing thing in my career. It is. I'm still sort of processing it. I was notified just a couple of weeks ago, and I'm so grateful for the individuals who were willing to support my nomination. And Steve, you deserve a special thank you because you were one of those people. But just the idea that I am now in this group of my colleagues who have been the recipients of this award over many, many decades and years. For instance, Dr. Alice Villalobos, who's one of the pioneers in animal hospice, coined the phrase animal hospice, so we could really differentiate it from human hospice. Dr. Patty Olson, who has served in so many capacities and was in fact the president and CEO of the Morris Animal Foundation for a number of years, as one of only one of several really iconic roles that she has played in the profession. I mean, it's just the list is really it's really humbling to be included in this group of individuals, but it's really I'm so very proud and pleased to be able to say that yes, in fact, I've earned this honor of being the Companion Animal Veterinarian of the Year for 2020. It's really exciting.
You know, without the human-animal bond, I doubt either of you actually would be in. I mean, because there'd be no pets, right? Without the bond. But you know, the human-animal bond is a really difficult thing. I'm about to ask you an impossible question, Dr. Downing. It is a difficult thing to define. How do you define the bond? So that's my question for you.
Okay. So first of all, I think it's important. So I need to acknowledge that in my first career, I did a mixed practice, even more mixed than my current practice, in north central Wyoming. And in that practice, I was mostly companion animal oriented, but about 20% of my practice was comprised of horses, primarily working horses and performance horses, endurance horses. So they would go on these ridiculously long rides and compete. But I also worked with food and fiber animals as well. So I have a little dabbling in that area. And those relationships are very different from the kind of relationships that I serve now as an exclusively companion animal veterinarian. But how would I define the bond? Well, you know, it's interesting. I've lived long enough to have witnessed this cultural and societal migration of biblical proportion of our cats and dogs from the backyard to the back porch, from the back porch to the kitchen, from the kitchen to the couch, and from the couch to the bed, to the bedroom. We usually to the bedroom first and then to the bed. And some of you, like I had the privilege of sharing my life for 9 years with a Cavalier King Charles Spaniel. And Tommy was crazy. But I'll tell you, one of the things that just blew my mind about Tommy, the Cavalier King Charles Spaniel, and I have clients who have this breed, and they tell me that their dogs often behave this way. His favorite place to sleep? Under the covers at my feet. Now, I'm not sure how he breathed under the covers at my feet. Now, I would also let you know that if someone had told my 20-year-old self that at my 50-year-old self would have a Cavalier King Charles Spaniel sleeping under the covers at my toes, I would have been like, you are clearly smoking something.
You're in Colorado. It's okay.
Yeah. And now I live in Colorado where the hip come to trip. But I would never have believed in a million years that this would be my reality. This relationship that we have with companion animals, this healing relationship that we have, the human-animal bond, you know, it's all great to talk about the emotion that we feel toward them when we interact with them. But I think it goes way beyond that. When we understand that we actually reap health benefits from this relationship that we have with these animals. And I realize that I risk now sounding a little, oh, it's so clinical to think about, but we have data that let us know several things. One is, if you are a cancer survivor and you have animals, your disease-free interval will tend to be longer than those people who don't have animals in their lives. If you have a cardiovascular event that results either in cardiac artery graft surgery or stent placement, if you have animals in your life, your rehabilitation time will be shorter and your life expectancy after that event is longer. We now have data that let us know if you are hypertensive, which many, many, many people are in our culture, if you have an animal in your home, in your household, in your family, and you interact with that animal on a regular basis, you actually could minimize your risk. You minimize your risk of a cardiovascular event, but you also may be able to decrease your use of medication. And then there's that old saying that if your dog, I have to think now how this goes. If you are fat, your dog is not getting enough exercise. Well, alrighty then. Animals, dogs in particular, take us out of our homes. We got stuff we got to do with them. I would argue that the same is true for cats, but we get a different benefit from our relationship with cats than we get with dogs. We all know that dogs drool and cats rule. And so dogs have masters, right? But cats have servants. We are the servants of those cats. And so I would argue that cats give me a reason to live because I live to serve and they demand certain things from me, particularly Muffin, who's now 24 years old.
Which is just amazing, the 24-year-old cat. I thought I was doing well with my 17-year-old, who Dr. Downing has helped me with as well. So let me talk about that in the few minutes we have left,
Okay.
and that's pain relief for cats. You alluded to this, but I want to more than allude to it.
Okay.
At one point when you first began in veterinary medicine, you probably had two choices for pain relief for cats. One was whatever drug you were using then, and the other might have just put the cat to sleep or something. Just that kind of sleep.
Yeah, no, I know.
Make them tired, which really doesn't relieve pain necessarily. So today, lots more choices. That's what I'm getting at. Okay. So can we help our cats doing all sorts of different things, from the CC loop, which you can explain, to nutraceutical products, to, yes, analgesics. Do we have even rehab for cats?
Mm-hmm. Mm-hmm. So I'm so glad you asked that question. So it's really important to understand that cats are not small dogs. So we can't actually take this exact same approach with cats that we do with dogs who have pain. However, we do know that in order to treat pain effectively, we need to take what's called a multimodal approach. So that means there is no silver bullet. We have to do more than one thing at a time. And this, for the cat owners who are listening, this is really important. Like, don't be deceived, and don't let your veterinarian tell you that we're going to do this one thing and it's just going to take care of everything. That's not how it works. So we think about the cat as the hub of a wheel. So the cat's in the center of this wheel, and they are the target. They're the target because they're painful. And so the tools that we use are like the spokes on a wheel. And it's like all spokes lead to the hub, all roads lead to Rome. So all those tools protect that cat. So what are the tools that we have available? Well, we have multiple nutraceutical tools. So we have a molecule called microlactin and a product called duralactin that decreases pain and inflammation. We have a tool called UC2, which works on the immune system to decrease damage to cartilage. We have polysulfated glycosaminoglycans in the form of a medication called Adequin, not labeled for cats, I am obligated to say, but I don't work for the company, so I can tell you that cats benefit from this medication, and cat owners can be taught to inject it under the skin at home. We know that omega-3 fatty acids, specifically EPA, can decrease pain and inflammation in arthritic joints. So there's another tool for us to think about using. We also know that normalizing body composition is really critical to decrease pain and inflammation. So that means using a nutritional product that is appropriate to help the cat's body burn fat and build muscle. These are all things that you can talk to your veterinarian about. And then there's the physical medicine piece. So we know that therapeutic laser or photobiomodulation, the use of light energy to have an impact on pain and inflammation, excellent tool. The Assisi loop that you have alluded to, targeted, pulsed, electromagnetic field therapy. That's a big mouthful. It's easier just to say Assisi loop, but these are magnetic fields that actually interact with the body to decrease pain and inflammation on a molecular level. And this is a tool that can and should be used at home. It can be used every single day in the hands of the cat owner to help that cat feel better. And then finally, other rehabilitation techniques. It's very funny when I love the reaction I get when I mention to my clients or to colleagues that I actually put cats into my underwater treadmill to build strength and to increase mobility in osteoarthritic joints. It is a thing, and it's not an exotic thing. I'm not going to tell you that they're thrilled to be walking in the water, but I can tell you that they're many times willing to do it. The other thing that I do is I'm a medical acupuncturist, and I can just let you know that medical acupuncture, so I don't do the earth, wind, fire, woo-woo kind of acupuncture. I want to know anatomically, neurophysiologically, what am I doing? When I put a needle here, what am I doing to the nervous system? So I practice medical acupuncture, and I often teach medical acupressure to my clients that they can use at home in between visits. And I am also trained as an animal chiropractor. And even though my training was in dogs and horses, this is one place where I actually do translate what I learned on dogs and horses for the cat. Cats are actually remarkably more like horses than they are like dogs from a chiropractic perspective.
I've heard that, yeah.
And my cat patients benefit from this. So all of these pieces that I've just mentioned, I don't choose one or even two things to do for my painful cats. I look at the entire, think of it as a palette on a painter's palette with all the different colors. And what I do is I choose those colors that are best suited for the individual kitty I'm dealing with. And I partner with the cat owner, with my client, who is really technically in my practice a member of my extended family. We partner together for the benefit of that cat. And our common goal is to help that cat live the best life, the longest life, and the most natural life, and the most comfortable life they could possibly live.
You know, Dr. Bales, the number is 7,829 veterinary professionals that I know. Nobody, no one like Dr. Downing.
This has been one of the finest hours of my veterinary career. And I feel that we were able to touch on so many different things that each one could deserve their own hour. So would you come back? I think talking about actual strategies for pain management and all those amazing things that you talked about, most people don't know. And I'm so excited to have those options. And I have to tell you, explain things really well.
Thank you. I would be honored. Honestly, this has been such a fun hour for me as well. And such a pleasure finally to meet you, only knowing your reputation up to this point. And I would be delighted and I'm truly honored to have an opportunity to have conversations in the future where we can really put a laser beam focus on some of these topics that we touched on tonight.
Well, I will look forward to that. I will look forward to that. Congratulations on your incredible award.
Thank you. Thank you.
And Steve, thanks for joining me, as always.
Of course, of course. Say hello to Sharon. I just love you and admire you, and I will leave it at that. Thank you all, those of us who joined us. A shout out to Kristen Levine, who I know, so thank you very much, Kristen. Thank you all for those who asked questions. If we didn't get to you, we're sorry. And I'm going to post this as a YouTube video at some point within the next week or so, and folks can check it out on my website. Good night to everyone, and thank you all.
Let me say one final thank you to Dr. Liz and to you, Steve. Please give my best to your lovely wife, Robin, and to all of you who have joined us this evening. Such a privilege for me to be able to speak with you tonight about one of my favorite topics, cats, and more cats.
Good night. Thank you.
Good night.